few moments later.
So, Dr. Teo, seems like you're very busy with appointments lately, huh?
Hey, who are you? Hey, take out this thing. Take out. Take out.
Doctor, I'm a kidnapper. But don't worry, I'm a kind kidnapper. Today I just want to send you to work so I can have a few words with you. Just a short conversation, okay, Doctor?
So on, huh?
Okay, sure. Just 4 questions.
Okay. Would you pass?
So, as all of us know, Dr. Teo is a very experienced and renowned oncologist in Malaysia, JB, and some say in Batam too, right? So, Doctor, what makes you choose oncology as your specialization?
Actually, I don't know. Yeah.
You know?
Yeah, I don't know. At first, I was thinking that don't you think oncology is very cool? And it's something very difficult, very tough, and not many people want to do this. Not many doctors want to do this subspecialization.
Oh, so nampak very gaya lah.
A bit different, a bit unique. But eventually, I realized that oncology is really truly something different. We spend a lot of time with patients. We spend a lot of time with the family. We are not actually managing the disease. We are managing the patient and the family. I enjoy talking a lot to the patient. They share a lot of their experience, their stories, their feelings. That's why all my patients, they know that I talk a lot.
So not just an oncologist, you're also a psychologist, huh?
Yeah, I like to do it in a way because I learn a lot from them. They share a lot of their personal feelings, beliefs, and their thoughts so that I can modify and implement it on other people so that I can keep on upgrading and improving my skills and my treatments outcome. Yeah.
Doctor, with so many things that you are doing, how does an average work day looks like for you?
On paper, 8 hours.
Wow! And practically?
16 to 18 hours.
They ask you how you are, you just have to say that you're fine.
Wow, that's a lot.
Yeah, that's why I look at my eyes.
So last time Doctor very handsome, now look at the eye bags. It's all because of his sacrifice for the patients. Okay, so Doctor, what do you think is the most challenging part of your work as an oncologist?
It's not actually about the disease. To manage the disease is not difficult. The most challenging and difficult part is to manage the patient and to manage the patient's family.
You mean because they are very stressed out with the life-changing experience that cancer is bringing?
Yes, and the most important thing is that they lack of guidance. And they will live in fear, anxiety, depression, everything. Oh, no. So they need someone who is reliable, who can give them a very clear and meaningful way of explaining what are the options they can choose, the pros and cons, then the cost effectiveness, of course, and then and a lot of further information, and to guide them, to tell them what is the most appropriate thing for them to do at that moment. And this is very difficult and it's very time consuming. Yeah, that's why it's very challenging. And another thing is to manage their expectation. It's difficult to manage expectation. Let's say patient want it to be 99, but you can only give it to 95. Yeah. So in the patient's eye, you are still failed, you know. So we must always help the patient to set a reasonably achievable outcome. Then only we improve from there. Then the whole scenario will be different.
I see, Doctor. So if given a second chance, would you still choose to become an oncologist?
I'm too tired. Very tired, very time consuming, very hectic. And oncology is one of the very few subspecialty that we need to spend a lot of time in learning new things. In oncology, we don't have a very clear-cut clinical practice guideline is because the treatment changes every month or maybe every few weeks. So there's no guidelines for us to follow. And then there are just a lot of consensus and based on the latest data, and then we need to read journals, we need to attend conferences. No, it's very tiring.
So what would you like to do if you're not an oncologist?
Stay at home and sleep. And spend more time with my family, my friends. Yeah.
I think this is very important. In one of the previous video with Dr. Teo, he did mention a very important pointer.
所以我对癌症康复者的建议就是，开开心心过好你的每一天，该怎么活就怎么活。
Live life happily every day. Is that correct, Doctor?
Yes, because we only live once. Okay, we only live once. We need to make our life meaningful, and so that one day, before we left this world, at least you won't regret that you have been here.
Okay, Doctor, thank you for your time today. We have arrived at the hospital, so I hope you don't report to the police, yeah? Okay, see you again, Doctor. If you like this kind of content from Dr. Teo, please like, comment or share this video to more people and let us know what else you would like to hear from Dr. Teo. Doctor, one more question from your patient. If it's so hard, what makes you persevere after all these years?
With great power comes with great responsibility.
In 3, 2, 1, action.
Hey, who are you? Take out this thing. Take out.
Hi, doctor. I'm a kidnapper. But don't worry, I'm a kind kidnapper. Today, I just want to send you to work so that we can have a short conversation with you.
Short one, huh?
Short one.